Thank you very much for inviting me here today to speak. I think some people may be asking, what's a medical health officer doing talking about child poverty? Shouldn't he be out putting up a quarantine sign or vaccinating a kid or inspecting a restaurant or something like that? And I think obviously that's part of our job, but it's clear more and more that the effects of poverty, particularly child poverty, have an enormous, practically an incalculable effect on children's health and on adult health when those poor children grow up. I'd really like to talk about three things today. The first is the relationship between child poverty and health. Now, we've known for a long time that poor kids have higher rates of virtually every illness that kids get. Asthma, respiratory infections, ear infections, gastrointestinal infections, injuries, the list goes on and on. I don't think there's one example where poor kids don't have worse health than kids who aren't poor. But if that difference was eradicated by the time these kids got to be adolescents or adults, maybe it wouldn't be such a drastic situation. What we know more recently is the effects of poverty on families, young children and growing families, and even on fetuses, is that this sets the stage for chronic disease later in life. We know that kids who grow up in stressed families with poor nutrition and not enough income are the very kids who will grow up to have the highest incidence of chronic disease, diabetes, cancer, heart disease. We can't afford this. It's just as simple as that. Not only is it unfair as a society, particularly a society that values health care as an equitable good for all society, but we just can't afford it on the bottom line. The second thing I'd like to say, besides that relationship between poverty and ill health, is the relationship between income inequity and ill health. And I'd particularly like to draw your attention to fact sheet, the page 21 and 22 of the report. And there are two things in particular that I'd like to underline. The first is on page 22, how poverty affects healthcare costs. And you'll see there that there are three just examples of how poverty affects healthcare costs. If you earn less than $30,000, you are almost a third more likely to use healthcare, to need to use healthcare. You were 8 times more likely not to fill a prescription or to stop using prescribed medication because you couldn't afford it, and almost twice as likely to be diagnosed with a chronic condition than if you made $60,000 or more. The second thing that we know, and this is very recent research, the second thing we know about inequity is that the larger the gap between rich and poor in a society, the worse the health status is in that society. This has been shown between countries, between states in the United States. This is very robust scientific information. And if you turn the page, well, it may not be on that page actually, it's on the same page, and you look at the disparity between the poorest 10% of families with children and the richest in BC, you'll see, first of all, that the absolute difference is absolutely astronomical. We're looking at an average income of the richest 10% of families with children of $265,000 a year, compared to less than $20,000 for the poorest. This is the largest disparity in Canada. And it really contributes enormously, not only to the burden of ill health that these families and these children suffer, but it also means that we're mortgaging our future because these children will grow up to be a burden on our healthcare system not only from the healthcare point of view, but also from the societal point of view, because they won't be able to contribute economically as much as people who are in good health. So the final thing I'd like to say is something about the bottom line. There are a lot of terrifically good reasons why we need to reduce child poverty, equity, morality, ethical behavior, just because that's the kind of Canadian society that we want. But if you want to be really cold-hearted about it, we have to look at it and say, we cannot afford child poverty. We cannot afford to fix it, because in all these areas, whether it's childcare or adequate revenue for poor families or diminishing the gap between the richest and the poorest, we know that investing now substantially in reducing child poverty and investing in children with young families will bring us rewards that are much greater than that initial investment as a society. And here we're talking about hard dollars. We really just cannot afford to continue not doing enough to eliminate child poverty. Thank you.